Is it audible? Yes? Audible? Yes.
Yes, ma'am.
Yours?
It's audible.
Yeah, okay.
మేడం
Yours is future.
వినిపిస్తుంది.
Okay.
నా వాయిస్ వస్తుందా మీకు?
వస్తుంది.
వినిపిస్తుంది.
Okay. Sir?
మేడం వాయిస్ వినిపిస్తుంది.
Okay.
Now we can start. Good morning to all. I think 13 candidates joined. We have sent nearly 51 students. So 13 students joined. Okay. Good morning to all. I am Dr. Prasad Babu, Assistant Regional Director, IGNOR Regional Center, Vijayawada. Today we have meeting with the students of MSCCFT and PGDCFT, learners of 2021 July session, and those who have not completed the first year MSCCFT or PGDCFT in the session July 2021 also we have called. Those who have not completed. So altogether 51 students. So this session July 2021. Mic off chestara megata vallu please. So July 2021 session we have 18 students MSCCFT first year, remaining 13 students PGDCFT PG diploma program. So altogether 31 students from July 2021 session. So already we have conducted one orientation program. TJPS college, all the students allotted to the TJPS college Guntur. Again we have received the guidelines from the Delhi headquarters, facilitative guidelines for completing the practical course, internship and dissertation. So what they have mentioned that earlier we used to conduct the sessions face-to-face mode, how to do practical component and field work journals and all those things. And remaining theory papers also few classes we used to conduct. So after the COVID situation, we stopped the face-to-face counseling and directly Delhi people are conducting the online sessions. So last year also they have conducted. This year also they are going to conduct. When they are going to conduct, we don't know. Till that time, our students are keep on asking to regional center, sir, when we have to submit our assignments, when we have to submit our practical component, where we have to do practical component, how to do practical component, whether we have to do all practical records in each practical 10 case studies we have to write or not. So all these questions are coming to us. So based on that, we decided to conduct today one orientation program for the learners of PGDCFT and MSCCFT. So based on that, we have first year MCFTL 001 theory paper, and this is practical. L means practical paper. MCFT 001 is the theory, MCFTL 001 is the practical. Same line MCFTL 002 second paper, developmental psychology, MCFTL 003 and MCFTL 004, MCFTL 008. In addition to that, MCFTL 005 also is there. That is a reflective journal. So each paper, practical paper is having the 100 marks. So internal assessment is the 50 marks and external evaluation is the 50 marks. So in general, you have to write 10 case studies for each practical. You have to approach the based on the your theory paper. You have to approach psychiatrist or school or something, NGO or like that. Now university is suggesting that you have to done 3 case studies neighbor to your house or near to your house or in your village or in your place, or if possible you can go to the psychiatry home and collect the information if possible face to face. So whichever is convenient, whether you are comfortable with psychiatric home and collect the information, well and good. If not possible, you can collect the based on the case studies given in the practical book. So out of 10, madam is going to tell you have to choose 3 case studies and collect the information based on the questionnaire provided in your practical book. Practical logbook is there. So whatever case studies you are going to collect, those case study formats you can take the xerox and fill the forms and bind it or staple it, these 3 case studies along with internal and external assessment forms are there in your backside of your practical component. All 5 or 6 pages you have to take xerox and attach to the your along with the 3 case studies and staple it or bind it or spiral it, whatever convenient to you. So in each paper you have to do like that only. Once completed the your practical component, all the papers, you have to submit your practical records along with your assignments to the study center TJPS College Guntur only, not to the regional center Vijayawada. So please remember that you have to submit your assignments on or before April 30th, or university may extend sometimes. As usual, we have the time. Assignment submission last date is the April 30th. Assignments are available in the IGNO website. Already we have sent the link also. Regarding practical components, you have 2 months time. So in 2 months time, 1, 2, 3, 4, 5 practical components you have to complete it, and along with your assignments you can submit to the study center. So based on that, your responses, internal evaluation will be done by our madam or myself. After that, study center will forward your all the practicum files or records to the Delhi headquarters for external evaluation. So external evaluation will be done by Delhi headquarters, but each component out of 50 marks, you have to get minimum 20 marks. 20 marks is the pass mark. So internal evaluation you have to get 20 marks, external evaluation you have to get 20 marks. Only reflective journal and internship and practical components, sometimes they may take 50% also. So minimum pass percentage is the 40% of marks. So each component you have to get 20 marks. So out of 50 you have to get 20 marks. Then only you will be passed. If you get less than 20 marks, you will be failed. Again, you have to submit your practicum record. This is the information before submission of your practicum files. So keep it in mind and write neatly. Take the case studies properly, fill the forms properly, write the description and all those things properly, and submit to the study center. Then only we will assess and evaluate the internal assessment and we give the marks. This is one thing. Sir, can you please tell me if those already completed 2020 batch need not attend this session? Already we have mentioned in the mail list, those who have completed need not attend this class and please ignore this session. Already we have written. If anybody joined, please leave this platform. Those who have completed. If not completed candidate only, 2020 session students, please attend. And details will be explained by the madam. This is the examination point of view. I am telling you. So each practical component you have to write 3 components. Already we have sent the guidelines. Please read the guidelines along with this. Already we have sent the guidelines. So please see the guidelines. Thoroughly see the guidelines. Based on that, you can write your practical records. Assignments already in each paper they have given the guidelines. Based on that, you can write your assignment responses and submit to the study center. From our side, this is the information. So now Dr. T.D. Vimala madam is there. She is a retired professor of psychology and a retired principal. Now she is working as a psychologist in the Nagarjuna University. Madam is the academic council of MSc counseling and family therapy since 2010, and same way she is also academic counselor and evaluator for the MA Psychology program, and she is also academic counselor and evaluator for the MSCCFT theory and practical components. So myself also evaluator come guide and external examiner for the MSCCFT and MA Psychology. So madam and myself both are the examiners for the MSCCFT and MA Psychology in the regional center Vijayawada for internal assessment and for external assessment of some other courses. So this is from our side. This week, madam will explain 2-3 papers up to 11 or 11:30. Next week again, if time is not permissible or if not completed the all the papers, next week again we will conduct the one more session. So this is the information. Any doubts or clarification, just 5 minutes. After that, madam will start. If any doubts, one by one.
Hello, ma'am. Hello, sir. Good morning. This is Madhavi. Can you just understand there are 5 plus 1, 6 practical books which we need to complete, and as it is mentioned there,
Yes.
it's we have to complete any three case studies.
Any three means out of 10 case studies, any 3.
Okay, in each practicum book you have to complete.
In each booklet, you have to do 10, but
Okay.
out of 10, any 3.
Okay, so that is individual choice. We can choose any three.
Individual choice or madam will tell you
Okay.
which
Yeah,
case study you have.
it would be really helpful if madam, I request ma'am to take one example and explain us
Yes,
how
madam will tell you. Madam will tell you all the candidates take the same case studies in your areas. So I am taking suppose a hysteria patient. So somebody from Vishakhapatnam, he will take hysteria patient in nearby his house. So case study is different, but topic is common, but case study is different.
Okay. And one more thing, sir. In the earlier orientation, we have been mentioned that the final date to submit the assignment is March 31st. And now
we take up to the, April 30th. Sometimes university may extend after April also because due to pandemic situation.
Okay, so even the assignments, we have time till April 30th.
Yes, April 30th you can submit. If any problem you can face, submit the assignments. Please call to us. We will tell the study center. They will take you.
Okay, that's great, sir. Thank you. Then I'll be waiting for ma'am to explain it.
Yeah.
Thank you.
Namaste, sir. I am Amiraju from East Godavari. Sir, I already sent assignment, sir.
Already submitted. Okay.
Only practical, sir, was submitted, sir. Please guidelines, sir.
Madam will tell you how to write the practical component.
Thank you, sir.
Okay. So now we can start the original session of the today program. Already just I inform about madam. So madam is a senior person and she is a counselor for last 30 years. So she will explain to you all the information. Whatever you have doubts. So after the madam session, you can ask. Madam will clarify. Even myself, I'll be here. If in between, if you have any doubts after the session, just you can ask. We will clarify. Now time is 10:15. So up to 11:15, madam will continue. After 11:15, if any doubts, I will clarify from madam side. If madam is there, madam clarify. Otherwise, I will clarify. Madam, welcome to the MSCCFT and PGDCFT group, madam. So thank you for your consent to give the orientation to our learners. Thank you, madam. Welcome.
Thank you, Dr. Prasad Babu. I feel, is it audible?
Yes,
is it audible? Yes. Thank you very much, sir. For all the administrative information regarding the submission of practicum, regarding the submission of assignments, dates, everything was given by Dr. Prasad Babu. Now let us come to the practicum part. I am going to give you the guidelines for all the 4 practicums, 1 reflective journal and the project. There are 6 things you have to complete. So let me start. I'm starting it from reflective journal because understanding reflective journal, that is 008. So which makes you to understand the entire lab activity. It makes you more easy for you to understand, to do the lab activity. That's why I'm taking 008 first. After that, we will go to the 1, 2, 3, 4. So that you will have a basic understanding of counseling and family therapy. There are 2 things in the title itself. One is counseling aspect and second thing is family therapy. So in this, what you have to do is the explanation and the understanding of 008. Reflective journal makes you to understand how to, you will have an insight about how to conduct a family interview or family therapy in a situation. So that's why hence I am taking the 008 first. Later on we will go to the 1, 2, 3, 4. So that this information will definitely help you to do the other lab activities. So I am taking 008, that is a reflective journal. So which is very, very important for you. This is a practicum which makes you to understand the entire, you will have an insight about the family and the individual counseling, to have a basic insight about the family and individual counseling. So as you know, this helps you, you are reflecting yourself. Reflecting means image. This is totally concerned about yourself. You are the best person who know everything. All information is with you. Hence, how to organize it. So in all counseling and psychotherapy, what we do, family therapy, what we do is, in a family, you will find out different. There are number of people will be there in a family. Each person is having their own personality and counseling, and other you have to understand what family is first. There are roles, responsibilities, conflicts, different perceptions among the family members. Sometimes you will have the activities where you are, it reflects that your family is a unit, and sometimes there are certain things which also, some negative events also occurs in the family. So you have to understand what a family is first. For understanding the family structure, family forms, family roles, responsibilities and conflicts and power, emotional relationships, roles and relationships. These are most important things. Many of the problems occurs in relationships and roles. Hence, you have to understand yourself first, keeping yourself as a client, as a person. So you are reflecting, because here you need not ask anybody for information. Every information is with you. You have to recollect the events and you have to write the reflective journal. So this, I think, if you understand yourself better in your family situation, this helps you to do the other practicum activities. So this is actually, this course is for practical purpose only, not getting the theory. So please do focus more on practicals. Don't think it is only for submission part. You will learn only through practicums. The base for these practicums are in your theory only. So don't think these are important. If you want to do, because why you joined here is to do counseling or family therapy. For that, practicum is important. For practicum, the base is the theory which you have learned in your theoretical aspect. So the first aspect with what we are going to do is on the reflective journal 008. So by this you are basically learning the skills of counseling, skills of family therapy and counseling. So in this, so these skills will be developed by understanding yourself, and you will understand the family, as a family therapist, how you have to think about. You will have an insight about this. Here there are 8 practicals. So there is also another thing. If you understand yourself, most important thing in counseling or psychotherapy is your personal things will not affect the either interviewing process or your observation process. You should be more objective. You have to look the event as an event, not with your emotion or not with your experience, not your information. This is very, very important. Objectively, you have to look at the client and you have to look at the situation and you have to look at the relationships or the roles. This is very, very important. Unless you look at the situation objectively, your prejudices and biases will have an impact on the counseling and therapy. So keep it in your mind. You have to look the situation objectively. You are the third person. You are the bystander. You should not involve in that. Emotionally, you should not involve. Always you should try to understand the situation. Understanding is important. Listening is important. Conducting interview is important. These three are important component of all the counseling and family therapy aspects. So before going into that, for this, we are using the information which you are having with you. So you will, under this, so I think you might have understand why I have taken first about the reflective journal, because the information is with you, you are analyzing, you are making conclusions, you are reflecting on the situations. Hence, you need not ask anybody. So no question of interviewing. You have to recollect and reflect on your own family. If you are clear and thorough about yourself, you will have a lot of proficiency or skill you can develop through this activity by doing counseling for you can work as a family therapist or doing counseling for an individual. So be thorough, think and have an insight into the reflective journal. So there are 8 practicums in this, as it is being given by Dr. Prasad Babu. You have to choose any 3. And what I suggest is, the very first practical is very important. After that, you can choose any 2 from the other, what I can say that 2 to 8 practicals, you can choose any 2 and do the first practicum, so that you will have, I don't say it is mandatory, but the first practicum gives you more information and more structuring of your family therapy. This is only to help you. It helps you to do more. That's why I am suggesting you can take any 3 as per the guidelines of the this authorities. You can do any 3 of the practicals among the given 8 practicals in the reflective journal. I will tell you the first practical. Go to the first practical which I asked you to do that. I think by this you have understood the purpose of this reflective journal. This is giving you an experience of a family, experience of counseling and experience of yourself. You will have a total understanding and insight about a family. We are living in the family, but we are doing so many activities, but we don't have insight about the family structure and the relationships and the roles. So we don't go back to that. So I am going to the first practical. So this is in the first practicum. What you have to do is, this is the self in the family, analysis of roles and conflicts. So these practicum journals the books are very, very clear, and in every activity there is an illustrative activity. So that this is page number 21. You can open in the journal, page number 21. This is the first reflection. What is reflection? Means image back, like a mirror. You are looking at that, what you are looking and what you are understanding back, reflecting your activities. You are looking at your activities. Reflection means you are looking at your activities and coming back. So that's why it is called as a reflective journal. What you did, what you talked, what are your roles. That's why I am talking it as a reflective journal. You are looking back into your activities. You are looking back into your roles in the family. You are looking back into the responsibilities you are doing in the family and the other members also. So that's why it is called as a reflective journal. It is, we are looking into a mirror, yourself into a mirror, and you are reflecting. Right? So this is the meaning of reflective journal. So now you are knowing about yourself and your family. So the first activity tells you how you have to do that. So for this, go to the page number 24. So how you have to do the activity. So for all this, the examples are given in the book and the illustrations are given. Just go to that illustration and do the activity as it is given. I'm going to tell you about the first activity because it tells you everything. All the 7 activities are very easy. Just you can read out. If I read out, you can follow that. In the first activity, there are this is experience about your family. There are 3 phases of this activity. In the first phase, you have to meet, this first activity is meet my family. So you are introducing your family to others. Others means you are reflecting. That is, you are telling about yourself only. My family. So you have to write down, you have to describe your family, your brothers, sisters, extended families, whether it is a nuclear family or a joint family or extended family, and all the relatives you are having which are close to your circle. You have to write down. So describe your family in the and mention their roles you play, mention the roles you play and the contributions you make in the family. What do you do in the family? What is your role? What is your contribution to the family? You have to introspect yourself and you have to, now you are in the stage of either adult or most of you are adults only. So you are having roles as well as your responsibilities. You may be staying outside your home in the hostel, but still you are a member of your family, even if you are staying outside. So you have to meet my family. For this, what you have to do in the record is you can write a family picture, or you can put a drama-like script about your family. So you have to introduce your family. This is the first thing. By introducing yourself, the family yourself, you will have a lot of insight and understanding about your family. You will have. So this is after writing this, or you can make a talk show also about your family. Whatever you feel like comfortable, you can make that and introduce other family members and describe some of their characteristics. Yourself, write about yourself, your roles and responsibilities, and secondly, other family members, their roles and responsibilities, and thirdly, mention at least 2 strengths and weaknesses of your family members. 2 strengths and weaknesses. Everybody is having a strength as well as a weakness. So that you will have clarity about your family first. What are the 2 strengths the member is having and what are the 2 weaknesses they are having. And after writing this, so 3 aspects you have to write. You have to describe your family, you have to write and your roles, and second point is you have to write about the roles and responsibilities of different family members, and thirdly, you have to write the strengths and weaknesses of each family member. You do it for yourself. That itself gives you a lot of information and your perception about the family, entire family changes. I can say that. After writing this, write your reflection. What did you understand by this? Reflection means after knowing all this, what is your reflection? You can write 4 or 5 sentences minimum, or you can write more, it is okay. So this is the first phase. Coming to the second phase, you have to write the Venn diagram. Venn diagram you might have studied in the theory aspect, where you will be in the center, yourself will be in the center, and you will draw lines. It tells you about your relationships in the family. The Venn diagram tells you about the relationships, making yourself in the center and writing if the line is long with the other member, if you draw a long line, it means that your relationship with that member is distant. If you put it very close, that your relationship with that member is close. If you put a dotted line, then you say the relationship with the member is negative. If you write a straight line like that, the Venn diagram you studied in your theory, You have to write Venn diagrams of your family. This is the second activity. So, and based on this, identify the strengths and weaknesses of each relationship you are having. You are having a relationship with all the members, sometimes negative, with some negative, some positive, some close, some distant. So you can write that. And you have to reflect on that. This is the second activity. And third activity is you have to do family experiences. Two experiences are given. One experience is where you have to describe the event in the family where it reflected that the closeness and unity of the family. The closeness and unity of the family. I will tell you one small example. If one of you fought with the other neighborhood boy and he came back, and all the family members together, they became one and they fought against the other person, outsider. It means that this tells that the family is a unity. Like that, you will have an experience of experiences where your family reflected as one. And it expressed that your family is closeness, experienced closeness and unity in the family. And the second exercise is, under this, there are 3 questions are given, you have to answer that. And there is also another experience, family experience, where you felt that there are so many conflicts and hostility in the family because of the event. Nobody, suppose one person is having a problem with the outsider, and nobody, even the persons in the family members are not supporting. Instead, they are working against him and they are hostile towards the person. All this experience tells that there is a situation where the family members are they are having conflicts, and the family is, you can just think about that so many situations happens in our family, so many events. Sometimes we reflect ourselves as a unit, and sometimes we reflect ourselves as broken members. So you can take all this, and at the end you have to write the reflections. There is an example given in this illustration. Illustration is given, and there is all the steps are given in page number 26. You have to follow the steps, that's all, by understanding. So if you understand your family, yourself, it gives a greater insight about yourself. This helps you to conduct counseling and family therapy outside, even in family therapy. So this is the first exercise. After that, there are understanding what all these components. If you understand, all this will help you in counseling and family therapy. If you know about all these concepts, that's why I asked you to do the first reflective journal, so that you understand. So you understand by now there are family roles, family relationship, family unity, conflicts, hostility, strengths in each member and weaknesses in each member. All this exists in a family. So while doing the counseling, you have to think about all these aspects. So some people will do the roles appropriately, some they don't do, even if they are having, which has a burden on others. So all this will help you to have an understanding of, and it helps you while doing counseling. And the second reflection is understanding what is help. This is just I am going through. So by this, they have given certain of the questions. By these questions, you will understand what help means. If you answer these questions, the questions are given, and you will ask. There are 2 types of help: receiving help and giving help. So in these 2 situations, some questions are given in the reflective journal, and by this you will understand what do you mean by help, the concept of help, which helps you in family therapy again. And similarly, there are understanding what is help, mistakes counselors and therapists often make. Third reflection is on mistakes. You can take a video of a counseling activity. You can look into the video of a counseling activity, and watching slowly about the counseling activity, you studied about the theoretical aspects of counseling. What are the errors you observed in that counseling activity? And what are the strengths you observed in that counseling activity? You can reflect on that. So this is even for that, they have given the questions. reflecting. For reflecting, they don't allow you freely whatever you want you write. They have given the questions. So you have to go as per the line. And similarly, nature of people. This helps you in counseling. This helps you about in counseling. And here also they have given questions. Similarly, incorporating therapeutic skills in daily life. How your skills are useful in your day-to-day life. You learned counseling and psychotherapy and how it is helpful in your family for you. So even on that, they have given some more questions. It should definitely helpful. Unless it is helpful to us, we can't do it to others. We have to take it, incorporate it, and make it helpful to us. For that, all this reflective journal makes you to understand different aspects of counseling and family therapy, which you are going to get in your practice while practicing family therapy. In family therapy, when you are practicing family therapy, you will get so many questions, so many doubts. All these are cleared by understanding and going deep into yourself and insight about yourself. So this is about the reflective journal. It helps you to develop basic skills about that. Whatever you feel comfortable, you write down your reflections. There is no standard. How do you feel? This is important. How do you reflect that? With your experience and with your experience. So I think, do you have any doubts regarding this paper? This basically, I will tell you, the objective of this reflective journal is, through yourself, you are understanding the concepts of family therapy. So what are the concepts you have to look forward while doing therapy, family therapy, or while doing counseling? That because without doing all the activities on others, you are doing it on yourself and you are reflecting. By that, you will understand the entire process of counseling and family therapy. So if you have any doubt, you can pause. Yes, we are going to the next lab. Do you have any? Yes, you can ask. Yes, you can ask. You just unmute yourself and ask, please. Yes. Please unmute yourself and you can ask the question. Somebody who posted it and it just went away. I am on cell phone. Please. Anybody? Yes. Shall we go to the next one, or do you have any doubt on this? Your microphone is not working. Then put me, it is just, right. You can put it in the chat box.
Question is there in the chat box. Can I read it?
Yes, you can read, Madhavi. Madhavi, you read it.
Yeah.
Yes.
Rupali is asking that, ma'am, I have a doubt that do we have to approach our potential clients for reflective journey separately or choose
not
the
at
clients?
all.
Okay.
No client at all. You have to do it yourself. I am telling from the beginning.
Yeah.
It is reflecting of yourself. No client, nothing. Your family, your role, your relationship in the family, your extended family. You need not go to anybody for this reflective journal. You have to do it on yourself. Okay?
Yes, ma'am. I think that should help her. Thank you.
Yes. You need not go to any client for this reflective journal. You have to do it. Okay. Yes. Thank you. Right. So that's why it is called as a reflective journal. By doing it, because all the material is available with you. All the material is available with you because you need not ask anybody about yourself, your family, or your roles and your relationship. So that also it makes you to analyze yourself, to understand the other families also. Yes. I think it is over. Yes.
Ma'am, do we have to write it chronologically? Like if we had a phase in life that from let's say first 10 years of my life was in a nuclear family, then the next 10 years or 15 years were in a joint family. So should I write it chronologically like that, or a summary of everything?
Yeah, you can yes, you can take the events from different situations, and
Okay.
whatever you feel like comfortable, because more roles, more relationship, more members, it will give
Right.
you more information, I think. Right?
Definitely.
Your
Yeah.
experiences, you can take it early stage also, whatever you
Okay.
remember, or you can take it from now also,
Okay.
whatever is
And if
comfortable
there
to you.
are
That
divorces
is
in the family, so the divorce was pre-divorce, post-divorce.
okay, okay. Yes, yes. All these can be reflected in the next thing I will tell you about how you have to represent that. Okay?
All.
So you can write whichever is your experiences. You can write your negative experiences, positive
Mhm.
experiences, wherever you might have felt about that. Okay?
Okay.
You are reflecting yourself here.
Right. Right.
So
Thank
that if you reflect yourself, it gives a clarity about yourself.
you. Yeah.
One way I can say that it is self-counseling also.
Definitely.
Yes,
Thank you, ma'am.
definitely it helps you. It helps you to understand yourself better.
Exactly.
Yes, objectively you have to understand yourself without any emotion.
Okay, ma'am.
So if you are emotionally focused, then the objectivity will last our objectivity, and we don't get the solutions.
Okay. So we
Emotional
are
focused, yes, yes.
so we are observing ourselves from a third person's perspective, objectively. Just
Objectively, yes, 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 yes. You should be a bysider without any emotion and write down and
sure.
analyze. Okay.
Okay, ma'am. Thank you.
Yeah, right, Shrekamma. Then coming to the, I think okay, it is journal first. So the purpose of that, you have to understand the purpose first, because it is a practical activity. Why you are doing this? Okay. Then next coming to the MCFTL Lab 1001. We will come to cover all the 4 and up to 5. Okay. So the first thing we are having, why I have chosen reflective journal is to have a greater insight into the other activities also. So by now you are able to analyze and observe the roles, relationship and all the things. So that, yes, yes, you can ask. Shabana is it Shabana? Is anybody? Okay. So
Is it audible, ma'am? Is it?
Yes. Sushma, is it
Yeah,
Sushma?
ma'am. Ma'am,
Yes.
this time I took admission in the MCF this master course, no, ma'am. So I
Second
will be
year.
in the second year.
Yeah.
So what
So
about my paper?
these things will not apply you. This is for first year PGDCFT. This session is for them.
So
Not
today
for,
my papers will not be discussed.
yes, no.
So
Second
again
year.
I'll get a mail, ma'am.
I think again you will get the mail for second year. This is the first year course.
Okay, then
Okay?
I'll leave, ma'am.
Oh,
Okay, ma'am.
okay,
Thank
right,
you, ma'am. Bye.
right. Then MCFTL 1, we are talking. The paper on theory paper on MCFTL is Human Development and Family Relationships. This is the title of the paper, Human Development and Family Relations. This is the title of the paper. What you study there is about the human development from infancy to old age. Infancy to old age, all the stages of development you will study from birth to death, I can say that. They are divided into some stages: infancy, early childhood, late childhood, adolescence, early adulthood, middle age, old age, like that. You are studying all the developmental stages in this paper. And in this paper, what you also know is, in each developmental stage, there are certain specific developments takes place more vigorously, and the other developments are slow. Some developments takes fast. Very development is more, and some other activities, the development is slow. So let me say for infancy, physical development is more. whereas social development is less. This is first 1 year, first few months. Okay. So like that, in each stage, some of the developments will be more and some will be less. So in each stage, you study about the social development, physical development, motor development, cognitive development, intellectual development, all the developments you study in your theory. In each stage, from infancy to old age. This is what you study in your theory. And in every stage, there are certain challenges. There are certain hazards they have to overcome. And in the development, you might be knowing what development is exactly. Development, there is a difference between growth and development. Growth is if it increases quantitatively. Suppose when you are 3-year-old, your height is 1.5 feet. When you are 6 or 7, your height will be more. When you are 10 or 11, your height will be 5 feet. So this is increasing in number is a quantitative growth. And the qualitative changes are called as development, not growth. It is not growth. Growth extincts, that means stops at certain age. After 18, there is no growth. Only development takes place. It takes place development from birth to death. Development means qualitative changes. Okay. Getting teeth is a development at 6 months. Losing their teeth at 6 years is also a development. So all qualitative changes, getting wrinkles on the skin is a development. Graying hair is a development. So all qualitative changes are called as a development. So there is no end. Development takes place from birth to death. And there is a normal process of development, and every stage of development has an impact on the next stage. If you don't learn the skills required at adolescence, it has an impact on your adulthood. If you don't learn the employment skills or whatever is needed at adulthood, it has an impact on your middle age. If you don't learn the skills which are required, do the activities which are required to do at middle age, it has an impact on your old age. So every process has an impact on the next stage. Hence, development is very, very important. So this is the overall picture of what you study in human development, and where the family relations also changes. When the person is in infancy stage, his relations with the family is one type. When he enters into adolescence, his relations changes. When he enters into middle age, his relations with the family changes. When he enters, so you should have an understanding of how a person's relations at what stage of development, at each stage of development. Hence, if you are interviewing a client, looking at your client, you have to understand the client's age, based on the client developmental stage. You have to understand the client, what it should be, how it should be, what is the natural process of development. So in this, we will basically, in all counseling activity, what you do is you will conduct interviews. This is important. Conducting interview, you should have the skill of conducting interview, one thing. The more than that, you should have a listening skill. Very important. Whatever the client says, you have to listen. And the third thing is, you should have an observation capacity. Observation is also very, very important. These 3 skills are important. If you have all the 3 skills, you can do the activity appropriately. These are the basic skills required for any counselor. You have to observe, you have to listen, and you have to conduct interviews. Suppose you are doing, you are observing, suppose if the interview, understanding the infant, you cannot conduct interview with an infant. You cannot conduct interview with an early childhood. What you have to do, you will observe for 1 hour or 1.5 hours the child, and then you will understand. If you don't understand, you will ask her mother or the caretaker. Yes. So observation skills are important. While conducting interview also, you should have observed the non-verbal behaviors of the client, of his emotional state. You have to sense that. That is also very important for conducting counseling or family therapy. So these three skills are important. One is interviewing skill, second is listening skill, third is observation. So you should be very thorough with this three. Practice. By practice only you will get this three. So if you know that I have to listen, I have to observe, and I have to conduct interview. I will tell you whatever is the interview with whomever you are conducting interview, especially for conducting these practicals, what you have to do is you have to fix the time, and you should be your time, date and time, and you should be really appropriately on the time, so that they are getting information for you. So they should respect you if you are there by that time. And the very first, these are the preliminary things. Preliminary things you have to follow. And the very important thing is here, while conducting interview, your voice is very important. Your voice modulation is important. You should show your concern through your voice modulation, and the words which you are using are very important. All the words should be caring, and they should be appropriately. You have to use the words. This is one thing. No judgmental words. No judgment at all in the counseling, in the interviewing. So in whatever is the interview, you have to conduct. The very first activity of any interview is rapport building. Rapport building is very, very important. You have to make a rapport with the client. So the client should be comfortable with you. You should be and he should feel at comfort and at home with you. Then only he will come up. So this is the first activity. How do you build rapport? Depends upon your skills. By talking, the general conversation, and asking some of the questions preliminary, and making him feel free with you. This is feeling free with you, so that he can reveal whatever, this is the first activity, preliminary activity. By asking some of the questions, we will make the person ease with us, ease with the client, you should make the client ease with you. Interview, whoever is doing interview, he should feel ease with you. So this is the question. This is the thing. So what are the questions you have to ask while interviewing? So for this paper, the basic focus is understanding the development of the client. That means the person is in the adolescent age. Is he as appropriate to the developmental stage? Or is he behaving like a child? Or is he behaving like an adult? Or is his behavior is appropriate to his age? We want to understand the development of the client. This is the process. So every time they are giving different aspects in your practicals, so that they can understand. So here focus is on understanding the development. In the development, first two stages, that means for infancy, early childhood or late childhood, you cannot conduct an interview. So to understand that stage, there are certain checklists of questions. You have to take the checklist. You have to observe the child for 1 to 1.5 hours. Sit with the child. Make some accessibility with the child. Observe the child for 1 hour or 1.5 hours, and then you have to make some conclusions. So this is the up to early childhood or late childhood. From adolescent onwards, you can conduct interview. You can conduct interview by developing rapport. So the main purpose is to understanding the development of the child. So in this, there are, I think, there are so many case studies are there here. So there are 10 case studies. starting with analyzing the different forms of family to understanding the roles and responsibilities of family members at different stages: infancy, early childhood, middle childhood, adulthood, and all the things, and genogram. These are the two things which covers the entire practical thing. You have to understand the development of different stages. And also for that, for everything, there are three parts. Part 1, for every practical, they have given a theoretical aspects, activity, and an illustration. You go through the illustration and follow the format given in the illustration, and you just do with your client in the same way, with the same illustration. You just copy the illustrative questions which were given in the illustration in your paper, and answer these questions by interviewing your client. Okay, this is the thing what you have to do after getting the information, by either by checklist, or sometimes we use checklist for early and infancy, early childhood and infancy, and later we will conduct interview. The interview questions or the checklist questions all are given in your illustration. You go through them, follow them, put the checklist questions in your record and answer them by doing it with your client. Okay. So while doing it with your client, what you have to do is, here for all the experiments, earlier it was mandatory to go to the client and conduct, and you have to record your interview and submit it. You have to record your interview and submit it. But because of pandemic, what they are asking you, whenever you conduct an interview, the rough copy, you can conduct the interview either by phone or using WhatsApp or any technology also, because of the COVID conditions. You choose a person of adolescent age group and you can conduct an interview. You can choose a person of middle age and you can conduct an interview. So you can use either phone or by you can use any technology, WhatsApp or whatever is that, or you can go directly to the client and you can conduct the interview. So in wherever you are conducting, with the consent of the person, you have to note down immediately whatever he says. This is the rough copy of that, or you can record them, audio record them. You can submit that audio record also while submitting your record. Okay, you can record with the consent of the client only. You can record whatever he is saying. If they are not willing, just you can write down. You have to take the consent of the client first, either audio or by writing rough copy. It tells you that whether the evidence for conducting of your interview. Okay, so these are the things about that. The main thing here is, after conducting the interview, you will come out with some findings. You will come out with some findings. After getting the finding, you have to analyze, you have to discuss and conclude, and then you have to write your reflection. So these are your contributions: conducting an interview and analyzing the results, findings, and discussing the findings, and then making a conclusion, and then reflecting your ideas on this. So these are the aspects you have to cover. For only three things you can take. Among the given 10, you can take whatever 3 which is comfortable, which you are having a client nearby. You can take 3. If you are having an infant nearby, you can go and observe the child, and you can get the information sometimes from the mother and by your observation. Like that, you can do the practical. So do you have any doubt about this practical MCFTL 1? This is for understanding the developmental stage of the client. Understanding the development of the developmental stage of the client. Any questions? So this is very easy to conduct because everything is given clearly. Illustration, you go rightly from the illustration. You just follow the illustration. That's all. That's all. Okay. Shall we go to the next?
Sorry, ma'am. So, ma'am, when we are submitting the practicals, do we need to write all these questions again and write the responses?
Yes. You have to write the questions, all the questions which are given in the manual.
Okay, and write the respective interview answers what we got it, and audio, like if they give consent and we were able to record the conversation, we can send it through post.
Yes, you can. Yes, you can send.
Like we need to put it in. We can send it in the mail or something, or like we have to send it in the post only.
Along with your record, you can send it.
Okay.
You are sending all your records to the study center. Yeah. Along with that, you can put that.
Okay.
Okay. Yeah. Or if you are not able to record, you can write the rough. When you are doing a telephonic interview, you can just roughly you can note down whatever is having. You can send the your rough work also.
Okay, ma'am.
Whichever is feasible because of the COVID condition, they just exempted.
Okay.
Earlier they used to insist on audios, but now this is the condition.
So for each practicum, like we are doing three different reports. Everything has to be in one binding.
Yes, all the three should be in one binding, and at the back of three experiments, you have to put the evaluation sheet. There are 5 or 6 sheets are there. For each practical, you have to put that. Not each practical, for MCFTL, at the end of the 3 practicals, you have to put the papers on evaluation sheets are there.
Yeah, which are there in the booklet itself.
Yes,
you have to just tear it and attach it to that.
And no tearing, you can take the copy of that and you can put it.
Okay.
Xerox copy of that you can put.
Okay.
Yeah, right.
Thank you.
So are you clear about this? Purpose. Always, if you are clear about the objective, you can do the thing well. The purpose is to understand the developmental stage of the client, whether he is up to that or not. Okay?
Yeah.
Then also there is one more thing is writing genogram. So this also writing genogram, you studied in your theory how to write a genogram. Genogram is you have to write with the symbols. So for girl there is a symbol like square, round, like that. When there is like that, so many symbols are given in your manual. You have to write the genogram. This example is also given in the illustration. How to write a genogram, how to write the relationship with you in the family. So that also is given in your practicum book, genogram. Examples are given in the illustration. You have to write that as per the family of the particular client. Okay? Right. Shall we go to the next paper? Yes? Okay. Shall we go to the next paper? Yes? Yes, you talk.
Yes, please, madam.
Okay. Thank you. Next, we are going to MCFTL 002.
Okay, madam.
This is on mental health and mental disorders. This is a theory paper you studied about as a therapist, as a counselor. You should have an understanding of mental disorders and mental health and mental disorders. Suppose you have to understand whether the client is suffering with any of the mental disorders. That's why this theory paper covered all the mental disorders which are frequently seen. Not all, but majority of the mental disorders like anxiety disorders, compulsions, phobias, like that. Many of that paranoid conditions, all these things, characteristics are given in your theory paper. So, for that, in this, the main important thing is, so this paper is because you are a counselor, you are doing counseling, you should understand some of the disorders. Unless you know the disorders, you can't understand, because the person is expressing anxiety, the client is expressing anxiety. So whether it is a general anxiety disorder or whether it is because of phobia, or whether because it is compulsion, or the person is having a paranoid disorder. You have to understand that. For that, you should have a clear understanding of this paper on mental health and mental disorders. Now you understood where the client is, by the developmental stage, whether the client is having all the developmental criteria as she is having as per her age, or is she having any depth of the some of the characters. We have understood about that. Now you are testing whether the person is having any mental disorders or not. For this, you have to, for understanding the mental disorders, you have to visit a person. Your client should be suffering with some mental disorder. That's why you can go to a psychiatric home where you can find people suffering with depression or anxiety or aggression or some phobias like that. Or you can go to a old age home with the persons will be suffering with aggression, depression, emotional disturbances, whatever is that. You have to meet a person with suffering with some disorder, psychological disorder, hysteria, anxiety disorders, whatever is that. You have to approach a person. This is a very easy thing. You are going to identify whether the person is suffering with any of the mental disorders. So if you are going to a mental disorder, then what you have to do is, in this manual, you have to do only two things. One is writing the case history, and second thing is mental status examination. These are the two things you can do for any psychological disorder. Any psychological disorder. So if you are having a thorough understanding of different psychological disorders which are existing, which are common, we will do counseling only to the persons who are normal. You can't counsel a person with deep depression. They will be admitted. So counseling is done only to the persons who are normal and suffering with adjustmental or some other problem. They are not completely away. They are normal, doing their daily chores with difficulty, with problems, with adaptive problems or conflicts or some other thing. So don't do counseling to a person who is totally depressed, totally schizophrenic, who cannot answer your questions. Do a person, normal person, suffering with some psychological, minor psychological disorders, I can say that, neurotic disorders. You can do counseling only to that person. Okay. So in this, you have to do two things. One is the case history. Second is the mental status examination. For this also, there are three questionnaires. How to write a case study, case history, and case history for adults, case history for children. Children's case history is different. The questions what we go for the children's case history is different, and the adolescent's case history is different. So there are case history questions for adults, one. Case history questions for children, and sometimes the case history questions may be answered by their parents or somebody. This is one thing. And second thing is for mental status examinations, we will go to the format given. So in page number 53, the mental status examination format is given, and so very easy. They made it very easy. In page number 43, children, for child and adolescent they have given, and there is a general paper is also given. There are three formats. So and after getting the information from all the three, if it is children, you can get the information from the caregiver also. Other things you will do it for ourselves. Okay. After getting the information, what you do is you will analyze the format, and after understanding the format by looking at that case study, just like a doctor, he will find out what disorder you are having after observing the mental status exam and case study. Similarly, you can say that you can analyze and you can discuss the condition, and you can diagnose, and you can make your conclusion. This is the activity you have to do for second group, second 002. Okay, 002 you have to do. So there are for this they have given mental status examination of different people. I think what is that? Young adult, female, like that. They have given 13 case studies, taking and case history and taking mental status examination of an adolescent female. So all these case studies you will take only to the person who is suffering with some mental disorder. Okay, mental health problem or mental disorder, whatever is that. Okay, old age people, female or male, all these are only given. So you can take any one of them and you can write them taking the information from the manual. All the steps are given clearly and you can write the case study and mental status examination. Do you have any doubts about this? Second paper, you have to write only two things. Everything is given. You cannot conduct this paper, this interview, this case history and mental status examination with a normal person. You have to go to a person who is suffering with mental health problem or who is suffering with minor psychological disorder. Hence, you have to go to a psychiatric clinic or a old age home or a place where even to a school counselor who can identify some of the persons suffering with some mental health problems. You have to conduct this case study and mental health examination only to those people, not to normal people. Okay? Okay, clear? Any questions on this paper, second paper? But you should be thorough about these mental health disorders. So that's why you can be able to understand, analyze and make some conclusions on that. Shall we stop here? And in the next session, shall we go to the third, fourth and fifth, three papers? We covered three papers now. Reflective journal. Just go through them and what is the purpose of doing all this and how it helps in counseling and family therapy. So I think all the students who join for this course are to do it practically. Hence, make a deeper understanding of the objective of this practical so that you can utilize it for different purposes. So, do you have any questions on this second paper? Yes?
I think yes. They don't have any doubts. while going for the practice, that time they may get so many doubts. So these doubts they will influence on the clients also.
Be thorough with that.
Before going to the practical component, please go through the theoretical paper, understand the psychological disorders. And basic things you have to learn two things. One, neurotic problems and psychotic problems. Don't go for the psychotic problem related case studies. Only go for the neurotic case studies, only neurotic related problem case studies.
Or mental health issues.
Mental health problems. Issues. So don't go for the directly schizophrenia patient or mania patients like that. So if you go to the psychiatry home or some other organization, so take mental health, those who are having the minor mental health problems. So then only you will get proper response and get proper information from the clients. And don't call it as a patients. We are not doctors. Don't call it as a patients. They are clients or subjects only. And okay, in our study center assistant coordinator, Mr. Markandale also is there in our group now. So any doubts related to submission of assignments and submission of practical records and dates, all those things, if you have any doubts, you can ask, he will clarify. How many of them submitted assignments? Only one. మార్కండేల్ గారు ఏమన్నా వచ్చినాయా మనకి అసైన్మెంట్స్ ఎంఎస్సిసిఎఫ్టీ కానీ పీజీడీసీఎఫ్టీ కానీ?
Wow, yes. One more question. They put it on the chat box. How to contact a psychiatrist? In the end of this paper, the journal, lab manual, there is a consent letter. You have to fill up that consent letter and get it signed. If you want to go to a psychiatrist, get it signed and then go to a psychiatrist. So because all this is not possible at present due to this pandemic condition, you approach a person whom you know.
That is better.
Because the consent letter is there. The consent letter is there earlier. It is on your manual also, lab book also. But there is, it is not possible. It should be you should get it signed by your academic coordinator and then it should be given to you. So it is, as it is a difficult process at present, you know to the persons whom you know well, so that who will cooperate with you. Okay?
No, even if they want to go to any psychiatrist, generally if they known to the person only, they will allow our students to do the practicum work. Without knowing the person, generally they will not allow us also. So you have to take some recommendation from some others. So then only they will allow you. Otherwise, what information you are going to take from that institute or hospital, so immediately they will not accept to you. So go with some recommendation or known to person, that is better. Immediately they will give you permission.
Sir, what is the last day to submit them?
April 30th.
Okay. Sir, for second years, when will you conduct this session?
Second year we conduct, because second year students, how many of them we don't know. So based on that we will conduct. Are you from second year student or first year?
Second year, sir.
Second year. Already completed PGDCFT or MSCCFT?
MSCCFT first year. I still did not submit the practical.
Okay. So in same way, second year also, madam. Same way, practical components are there. And only thing is internship and project is there. Internship you can do it. Already all the guidelines available in the booklet. Project also, everything it is available. Or you can take the secondary data and submit to the project report to regional center. We conduct the Viva OC. For internship, we have to submit and we will send to the Delhi headquarters.
Okay, sir. Thank you.
Okay, madam. Now we can close.
Okay.
Next week again we conduct. Sir, it is possible to collect the primary data. Can we?
Yes, I will tell you in the next class while conducting this project 005.
Even MCFTL 005, primary data collection is not essential now. You may complete using with secondary data also if you available. Go to the website and get the secondary data. Based on that, you can do also. Because collection of primary data not easy to collect now due to pandemic situation. So collection of too many people information is very difficult. So already it is there here. Primary data is not essential. MCFTL 5. So please go through the guidelines. Then you will understand what you are going to do. So without reading this, you can't go forward. Okay. Please read the instructions. Then you will understand. After that also, if you get any doubts or clarification, next session you can ask. Okay. Thank you. Bye-bye this session.
Thank you. Thank you, sir. Thank you.
Thank you, sir. Thank you.
In the class.